Now, is there such a thing as walking too little or too much after knee replacement? Well, there actually is. And if you're walking too much on your feet, then more than likely you're gonna delay the healing process of your procedure. So in today's video, I wanted to discuss exactly how much you should be walking after this type of procedure and go over some considerations that you cannot ignore. Let's get started. Welcome back, guys. This is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, I see many patients that have undergone total knee replacements, and one of the most common questions that I often get is how much I should be walking. And although right now I want to give you a clear answer, there are some factors that we need to take in consideration and some variables that you can control to help ensure that you are walking the right amount for your body. Now, before we get into the details on what a walking program can look for you, we really have to consider the factors that can have a great influence on every individual's tolerance to walking. The first factor that we're going to go over is the previous level of function. This is a baseline fitness level of what you were functioning at before the procedure. Now, odds are if you weren't walking very much before the procedure, you're going to definitely want to start off slower and you're not going to be able to walk as much after the procedure. But if you're someone that has been walking quite a bit, maybe 2 to 3 miles per day before this procedure, then at least you have a baseline measure of what normal is for your fitness level. So previous level of function is going to have a great influence on every individual's needs. The second factor that we have to consider is pain. And that's pretty simple. If someone is in a great amount of pain, they're gonna have a low tolerance to being up on their feet and walking. So one thing we want to keep in mind is as we're recovering from this type of procedure, you really want to stay diligent with taking those pain medications as you were instructed by your doctor, elevating your leg as you're instructed, and most importantly, icing. So you really have to consider what levels are your pain as you start testing out how much walking you're going to do over the next couple weeks. The next factor that we're going to get into that can have a great influence on your tolerance to walking is your health history. So if you're someone that has hardly any comorbidities, you might be able to recover and get back on your feet again because there's less complications with maybe the procedure or even the recovery process. But if you're one that is dealing with other conditions, maybe you have heart conditions or maybe diabetes, sometimes those conditions tends to delay the healing process. So with that in consideration, this might dictate how much you're going to be able to tolerate when it comes to walking. So the last factor that we have to consider is what your baseline stability and balance is going to look like when you start putting weight on your leg. There are some individuals that simply have a harder time balancing and showing confidence on that new knee. And there's other individuals that have an easier time putting weight on their leg, then they're completely confident. There's no right or wrong answer, but if you're someone that is maybe struggling with your balance, you definitely want to spend more time focusing on your stability first, and then start incrementally increasing the amount of distance or time that you're doing with walking. Now that we've gone over all of the factors and variables that will influence how much you can tolerate on your walking, let's talk about clearly how much you should be walking. Now, every individual is going to be completely different. And odds are, if you just had this procedure now, your surgeon or doctor is most likely going to want to follow up with you anywhere between 2 to 6 weeks. Now, every surgeon's a bit different, but just know you have to have the ability to walk not only within your home confinement, but also be able to walk out to your vehicle to go to your doctor's appointment. Now, some individuals do a lot of walking after their surgery. And if you look up or do a quick Google search, you will probably notice that most of the information out there is recommending anywhere from 20 to 30 minutes. I've even seen an hour after surgery. And if that is something that you're gonna follow right after your procedure, you are gonna be in a great amount of pain. Now, obviously, there are some outliers out there. Some people can tolerate more time on their feet and they do really well. But in general, most people are not going to be able to walk as much. There's a lot of factors that we just went over that can greatly influence that. So just take it slow and understand that this is just a process. So when you're starting off with increasing your walking, you're going to start with a progressive walking program. Each week, you're going to increase that time over and over. So that might look like the first week, every single day, you're making a commitment to yourself to walk anywhere between 5 to 10 minutes per day. This doesn't have to be all at once. This can be broken up in small sessions throughout the day, but every single day you're gonna get up on your feet and you're gonna walk 5 to 10 minutes a day. Then the second week, you're gonna also progress it. So instead of 5 to 10, if you're tolerating your walking program just fine, week 2 now will bump up to anywhere between 10 to 15, okay? Then week 3, you will also increase the activity. If 10 to 15 minutes is becoming more easier, then you can move on to 15 and 20. The main thing you wanna consider here to prevent yourself from overdoing it, because one of the most common questions I get is, how do I know if I'm overdoing it or if I'm doing too much? You really have to consider 2 factors here. I tell my patients, consider how much pain you're dealing with and consider how much swelling you are having. And the way to understand that is if you are going through your walking program, let's say for week 1, you have to understand that if you're overdoing it, those effects are really not going to kick in until 24 to 48 hours. We call this delayed onset muscle soreness, and this is soreness that comes after you perform that specific activity. This is a great indicator to let you know if you are simply overdoing it. So odds are after 24 to 48 hours, if you're not experiencing these symptoms or not having a lot of soreness or pain, then you can start to increase that activity each week at a time. Coming back to the other factors, which is your pain and swelling. If you start walking and within a couple days, you're noticing that the pain starts to increase and the swelling starts to get worse, this is a great indicator that you definitely want to move slower and not overdo it. If you ignore these signals, I guarantee you that your procedure will take longer for you to recover, because now you're ignoring those signals, and now your pain is going to start to really limit your ability to put pressure through the joint in the leg, and then just standing in general is going to feel very sensitive. So these are signals that you don't want to ignore, and that just tells you that you want to move a little bit slower and really monitor the symptoms that you're experiencing with each walk. Now, I want to reiterate that every single person is going to be different, and most of you watching today are going to obviously compare yourself to someone else. Maybe you have a friend or family member that is saying, after the procedure, I was able to be up on my feet and walk 1 mile. And it does happen, but it doesn't mean that is the normal, and you cannot compare yourself to those individuals. What you need to focus on is your journey alone. And you need to understand that every week is going to get a little bit better if you can stay consistent with your walking program. Now, one important point that I want to bring up is, how can individuals track their progress? Most people like to see objectively how they're improving and whether they're getting better. Because if we just tell you to walk 5 to 10 minutes at a time, it's a very generic number for most people. And there's some of you that are out there that really want some details on how they can track how much they're walking. So one way that I allow people to kind of track their walking is by tracking their time, which I've already told you. When you're tracking with this walking program, you're gonna, on your phone or on a timer, you're gonna track how much you're actually walking. So that's 5 or 10 minutes. And that's one way over throughout the next couple weeks that you can keep track of how much you're doing. The second way, which is one of my favorite ways, is using some type of smart device like a watch or even a pedometer that you can use to help track your steps. So tracking your steps can be a great objective way to help you stay on track, so that when you're working on that duration of time while you're walking, you can see specifically how much you're walking each day. And over the next couple weeks, you definitely want to bring that up and slowly increase that amount of time. The last way that you can track the amount of walking that you're doing is simply measuring out the distances. Now, if you're living at home, it's as simple as, finding a walkway within your home or a little area from your bedrooms or to your kitchen, and really marking out that distance and using that distance to do laps around the home. This will allow you to keep track of how many laps you're doing, and then you can identify really how much distance that you're actually covering. Now, one thing I want you to definitely ignore when you're thinking about walking is the whole recommendation of walking 10,000 steps a day. This is not going to be applicable for you at this time. So if you hear anybody make those recommendations, you really have to focus on your journey, what you are working on. If you were to try to shoot for walking that many steps after your procedure, if you're maybe anywhere from post-op day 2, anywhere from 3 weeks, and you try this, you're gonna be in extreme amount of pain and a lot of swelling. So focus on incremental steps. And for you, that might look like, hey, I'm gonna shoot for 1,000 steps a day. And next week, I'm gonna shoot for 2,000 steps a day, and the following 3,000. So just consider and start to monitor how you feel each time. Now that we've gone over all of the factors that can influence your tolerance to walking and have given you a better picture on what a walking program can look for you, let's go over a couple considerations that you want to think about. First consideration is the level of the surfaces. Are you walking inside where it's completely flat, or are you walking outside where there's a lot of unlevel surfaces? And the reason why this is important is because when you are outside, you're going to be encountering many different terrains and surfaces such as steps, walking on gravel, walking on concrete and grass, which is going to be completely different than just walking on flat surfaces. Many of my patients will say, well, I was walking just fine inside my home, but when I went out for a walk outside, it was a lot harder. Well, that's because you're most likely encountering slopes and steps, which is going to have a greater impact on your knee. Now, there's nothing wrong with that because we obviously want you to get back on your feet again to be functional and walk back into the community, but it is a consideration that you have to keep track of. The next consideration is how much standing you're doing. Now, many people might think that standing has nothing to do with walking, but essentially it's very similar. You're spending more time on your feet. Your full body weight is on that knee, and can be extremely painful if you're standing for long periods of time. So just because you're not walking for that amount of time, even just standing can have that effect on you. So if you are gonna focus on increasing your walking, simply focus on the specific duration or distance that you're going for, and then rest and recover so that you can come back the next day and walk again. Now, the last consideration that I want us to focus on is us focusing on your quality over quantity. As I mentioned before, many people compare themselves and they're really just focusing on how much they can walk versus what their quality of walking looks like. And the reason why this is so important is, sure enough, you might be able to tolerate longer distances, but you might also be developing a limp and a bad gait pattern. And that's definitely something that we don't want to do when we're recovering from this type of procedure. Distance or time on your feet is not the focus here, but quality is the focus. And we really want to make sure that you're focusing on learning how to take large steps comfortably, being able to put full weight on that leg and not having any fear that you're going to fall over. Now, if you want more information on how to walk correctly and some of the tips that I recommend to my patients, take a look at this video here. And in the meantime, if you found this video helpful and there's another topic about this procedure that you want to hear about, please list them in the comments box below. Otherwise, you can support me by subscribing to the channel, and I'll see you in the next one.